People who are sick or people who are injured, that's the absolutely wrong moment in their life to have them have the stress of fighting an insurance company that is not honoring the insurance policy.
I was surprised to learn about how much of a problem this is in Medicare Advantage.
Hello, Senator Merkley. Thanks for making the time for this conversation. Medicare was created almost 60 years ago to be the rock-solid guarantee of health care to some of this country's most vulnerable people.
20 years ago, the Medicare Advantage program was created by Congress, allowing private health insurance companies to offer a version of Medicare to beneficiaries. Has Medicare Advantage achieved its objectives?
Well, the short answer is no. Medicare Advantage overall has failed the American people, failed to provide better health care, and failed to reduce costs. The argument was that private business can do things more efficiently than the government, so if we let these private companies essentially have their own little piece of the Medicare world, they'll be able to deliver better quality health care at a lower price.
Problem is that's not what happened. What happened is that private companies said, we want to maximize profits.
So we will game the system to essentially record in our books that our patients are sicker than they actually are, and we will get paid more for each patient because we're putting artificially down that they are sicker. And so that profit motive drove the Medicare Advantage programs to being far more expensive than regular Medicare per patient.
In the past, many of your colleagues on both sides of the aisle have signed onto the Association of Health Insurance Plans letter of support for Medicare Advantage. Why do you think they signed on?
Well, in the past I signed that letter also because the Medicare Advantage had a pretty good reputation in my home state of Oregon, and there were some really scandalous stories about that in this last year, talking about doctors who had been pressured to essentially create diseases for their patients the patients don't have, to basically inflate their profits. Those articles really unveiled a problem I didn't understand or didn't realize existed. So at that point I was like, no, I'm not signing on to that letter, and I won't be signing on to the letter.
This year we saw a decline in support for the letter in the Senate, and no letter was even circulated in the House.
Turns out the government is better at delivering Medicare than the private companies because of that profit incentive that led to corrupted practices. It's costing our government somewhere in the range of $15 to $30 billion a year in overpayments. The idea of Medicare Advantage was to provide better health care at a lower cost, not worse health care at a higher price. That's very hard to defend. So I'm really glad that colleagues on both sides of the aisle are taking this very seriously and starting to step forward and say we're ready to consider ending this artificial inflation that is draining the national treasury of billions of dollars every year. You know, the problem of them artificially inflating the risk of their patients to make more money by charging the federal government more. That's one form of corruption. Another form is to fail to meet the basic Medicare standards of care and to deny to a family coverage for things that Medicare is supposed to cover. And this is why I'm proposing a bill called No Up Code that would say, hey, we have to stop the corrupt practices that have emerged in Medicare Advantage. Our bill says that you can not just use 1 year of diagnostic data, you have to use 2 because there's spikes that they utilize to pump up their risk assessments. It says you can't use chart reviews and health risk assessments that are not used in traditional Medicare to try to inflate your risk assessments, and that there will be a coding adjustment to bring the risk of the Medicare Advantage patients in line with the actual risk as compared to normal Medicare. And companies that cannot bring Medicare Advantage in line, honor the basic Medicare requirements, should be disqualified from being in the business.
For people who are relatively healthy, Medicare Advantage may seem like the better option. It appears to be cheaper and offers extra bells and whistles that traditional Medicare does not, like free gym and spa memberships. But the problem with getting older is that, inevitably, you get sick. We think Congress should make actual Medicare more affordable so that people can have the freedom to just choose or switch to Medicare. Congress could create an out-of-pocket cap for Medicare or guarantee affordable Medigap insurance. Heck, you could even pay for it with all the savings from the overpayments to private insurance companies. What do you think about those ideas?
I just became eligible when I turned 65, and I can't believe I'm in my 60s now, but it happened. It does come. And some 10,000 of us a day in America are reaching that point to trigger coverage. And what that means is we shouldn't be wasting any dollars. And so ways to look at strengthening traditional Medicare, as you suggested, and that applying the savings that we would realize if we were to end the $15 to $30 billion of overcharging that exists in current Medicare Advantage programs, I think that makes a lot of sense.
Medicare is a hugely popular program and has great support from the majority of American people from all political ideologies. What needs to happen to encourage bipartisan support for reinvestment and strengthening of Medicare? And how do we go from where we are now, fighting to preserve Medicare, to expanding this public good to everyone?
If you can work it on both sides, that is, if I'm able to advocate with fellow Democrats and Senator Cassidy is able to advocate with Senator Republicans, and outside groups are really weighing in to say this matters. That's kind of the best situation. But it will take presidential leadership. President Biden really called the Republicans' bluff.
Some Republicans want Medicare and Social Security to sunset. I'm not saying it's a majority.
When they were called out in public like that, the Republicans said, no, we're not, because they knew that what they're doing was very unpopular. And so that shows that there is the political muscle when President uses the bully pulpit to say we need to fix or improve Social Security, or we need to fix or improve Medicare. There's public support for that. We're going to need outside forces because the deep-pocketed Medicare Advantage companies will hire a ton of lobbyists, make a ton of campaign donations, maybe fund basically dark money campaigns to attack people who try to take on reforms. And I hope that President Biden will take the opportunity in his re-election effort to champion single-payer health care, improvements to Social Security, improvements to Medicare, and for that matter, improvements to Medicaid.
Amen. This was a fun conversation. Thank you for all your leadership in the struggle to transform our broken healthcare system. I'm looking forward to working more closely with you.
Thank you for your advocacy and for, through these types of interviews, continuing to educate the American public and help build that outside the Capitol support for changes. We have to have enough voices for reform that we overcome the deceptive framing, public relations framing campaigns done by powerful companies, including powerful drug companies and powerful Medicare Advantage companies. So huge thank you to you, and I'll look forward to working more with you.
Be well.